Hi guys, I'm a student of occupational therapy in Unimed, Ondo State, Nigeria. So, being a student in Unimed as a specialized medical university, I've made friends from different healthcare professions like medicine and surgery, dentistry, nursing, physiotherapy, and so on. These friends all ask me a general question that's what is occupational therapy and what is the course all about? One even asked me about 2 months ago that if there are already physiotherapists, so is there really a need for occupational therapists? And I thought about that question. So I thought maybe why not do a YouTube channel, a YouTube video, and to promote awareness to educate people more about the course. So yeah, it is. This is my first YouTube video about this, and let's see how it goes. So we're starting with the definition of occupational therapy. What is occupational therapy? The definition given by WIFOT, World Federation of Occupational Therapists, in 2012 is occupational therapy is a healthcare profession concerned with enhancing health and well-being through occupations. Now, what is occupations? Occupations are those activities that you need to do daily or that are expected of you to do as a living being. Now, we are moving to areas of occupation. Areas of occupation, there are 9 areas of occupation generally accepted by occupational therapists. We have basic activities of daily living, we have instrumental activities of daily living, we have play, we have work, we have leisure, we have social participation, we have education, we have health management, and yeah, that's all. So we are going to be picking them like one by one now. First, what is basic ADL, basic activities of daily living, all about? Basic activities of daily living are those things you do daily. Those activities you do daily, like bathing, dressing, um, toileting, transferring. I mean, those things you do daily as a human, those things you are expected to do daily. Of course, we have to bathe, we have to take care of ourselves, self-care, we have to toilet, we have to dress, grooming, we have to do a lot of things. So those activities that you do daily, those are the basic activities of daily living. Now, the instrumental activities of daily living, we have shopping, transportation. Those, they are more complex than the basic activities of daily living. So it includes using a a medium to do some activities like transportation, for example. You have to use a medium either by car, um, by bike or something to aid your transportation somewhere. So yeah, and communication, we have several gadgets used for communication. We have laptops, we have phones, we have Android phones, we have iPhones, we have different things used to communicate nowadays. So that is for communication. We have play, of course. Play is an occupation because as a child, as a child a small child, a kid is expected to play. A kid around 3, 4, 5 years, even 6 years, they are expected to play. If not, that means like something is wrong somewhere. Of course, why would you see a kid, a 5-year-old kid, a 5-year-old boy, not participating in play activities, like not just sitting on his own, maybe in his own world or something, like autism, maybe the child is autistic or something. So yeah, that's where occupational therapy comes in. And sleep as an occupation. Of course, sleep is an occupation because without adequate sleep, we will not be able to perform well, will not be able to function daily without sleep. People with insomnia nowadays, like they are just, it's just a lot. So I'm going to stop there under the areas of occupation, because this is just a brief introduction to occupational therapy. And the next thing I'm going to talk about, the next thing I'm going to talk about is the various specializations in occupational therapy. We have pediatrics. We have pediatrics, of course, that's the children. We have geriatrics, that's the adults. We have hand therapy for proper functioning of the hand. We have mental health. Yeah, we have neurology. We have different areas of specializations. So that's just the brief introduction. So where we come in all these things, where occupational therapists come in, the role they play in all these things I've been saying is that we basically deal with how our patients or how our clients are able to function well. We deal with how we improve their independence in all these daily activities, in all this, whether bathing, whether dressing, whether grooming, like in all this stuff. We in social participation too. Yeah, of course, social participation, because some people that are that have problems with it are really like, they won't participate in anything, whether meetings or stuff, like they won't just participate in anything like that. They need an occupational therapist. That is where occupational therapists come in. It's just they use now I've talked about the definition, the worldwide definition of WIFOT in 2012. Now my own definition of occupational therapy will be: occupational therapy is a healthcare profession that help people across all ages to develop or to improve, to enhance their function and their independence in everyday activities. Yeah, so we've come to the end of the video, and thanks for watching.